The same way, even radiation delivery techniques have shown fantastic revolution. That's what I call as biomedical revolution.
We now heard some new term called CyberKnife technique.
CyberKnife, because it is taken care by robotics in delivery, you have sub-millimeter accuracy and precision.
For a 1.5 month treatment was done in a single day.
Yeah.
I would be
so
scared.
So the biologic impact of this single session will be much higher than what you get over a 6 weeks treatment. No need for anesthesia. Any medical comorbidities, uncontrolled diabetes, hypertension, kidney diseases, stroke,
no
still no problem.
CyberKnife, please tell me for which sites we'll be using it.
Like lung cancer, liver cancer, pancreatic. Similarly, prostate cancer, one of the best options is radiosurgery.
Welcome to the New Indian Express podcast. Today, we are going to talk about the most scariest disease across the country, which is cancer. For that, we have Dr. Shankar Vangipuram, who is the leading radiosurgeon in the country with 2.5 decades of experience from Apollo Cancer Center. So, Dr. Shankar sir, please tell us why people get scared when they hear the term cancer. Is it really scary?
Yeah, so it's a very good question, Ms. Pavitra. The term cancer itself, it carries a big stigma in our society. And honestly, in our country, it's very scary. It has its own set of repercussions across gender and, more importantly, the society at large. First, before we understand about the scare, let us understand a little bit about what cancer is.
Yes.
Cancer is uncontrolled proliferation of the cells inside the body. Let's say if there is an irritation of my skin using this pen for one few seconds in a day, the next day the skin again replenishes. Right? There will be millions of cells which go off, but the body repairs that damage.
Yes.
Now you keep on continuously irritating it every day. The cells will get mutated. They also wanted to survive. So these mutated cells, they started proliferating. And that proliferation goes out of the normal control. That is what we said as cancer.
What is the advanced treatment and advancement has come?
Let me just tell you one thing, Dr. Pavitra. Let's say if there is cancer here on my hand, it is situated here. What I do, I cut it.
Yes.
That is the job of surgeons.
It's a
Surgical
traditional
oncologist.
surgery.
Yeah. Traditional surgery. You take a knife, cut it off. The second important option is you burn it.
Yes.
You burn it with radiation therapy.
Radiation therapy.
Now let's say if this cancer has spread from this area to any other area inside the body. You can't burn everything. You can't cut everything. So you have to use some modality which is pushed into the blood through the veins. So that is what chemotherapy is. That is the systemic therapy. Right? So in systemic also there are several advancements like targeted therapy, immunotherapy, chemotherapy, CAR T-cell. There are multiple options in systemic therapy. Everything depends on the stage in which we are doing the treatment. Essentially, whatever treatment we advise, the outcomes depend on two things. Number one, the stage of the disease. Right? If you pick the cancer in a very early stage, you're going to get good results. If you're going to pick the cancer in a very advanced stage, cure is out of question. And in cancer, the first thing you need to remember is the first treatment has to be the best treatment. Once something happens there, the chances that, and the disease recurs, chances that we doing something with curative intent is lost. So that is precisely the reason, whenever we see any new case, we try to sit across the table with our contemporary clinicians. I being a radiation oncologist and a radiosurgeon. I discuss with my medical oncologist, I discuss with my surgical oncologist, and together we decide what is the best care for the patient. So multidisciplinary approach is quite important in giving better outcomes. Number one, stage is the most crucial thing. Number two is how the patient comes to you is also very important. The age of the patient also is very important. You know, how the patient comes to us and the age is important, because if I advise some treatment to the patient, they should be in a position to tolerate it. If they are not tolerating it, you can't use such kind of heavy treatments onto the patients who cannot tolerate, because that will cause a lot of toxicity. Side effects will be very large and the patients cannot tolerate. Many times patients so happen that they come to me and ask me 2-3 times, "Doctor, are you sure my father is going to tolerate or not? Or my mother is going to tolerate or not?" It's very important for us to see the patient, assess the tolerability properly, and because we have decades of experience, we know how these patients pan out post completion. We have a fair idea about how they are going to get through this entire stuff.
What would be your suggestion for old age people and for children?
So again, it's very important. Everything depends on the stage of the disease, the site of the disease,
Okay.
and more importantly, the age of the patient and the general condition. So if you look into the extremities, you know, you can't do aggressive surgery there. Right? Extremities on if you are speaking about a 90 years old patient who is having, say, some liver cancer, small, you can't do aggressive surgery there. Similarly, if you are having let's say 5 years old kid or 2 years old kid with a brain tumor, you can't do aggressive surgery there. You can do, but the benefit you're going to get is very marginal. So everything depends on the site of the disease, and more importantly,
their health condition,
the age, their tolerance. You know, suppose if the patient is not able to undergo aggressive surgery, what is the best option? We have to get the tumor rid, right? We have to get rid of the tumor. How do we do it? We give with radiation and milder doses of some chemotherapy just to sensitize our radiation in a much better way. All these tools and techniques will actually make sure that we deliver better outcomes for our patients.
What is the newest or what is the advanced treatment?
Radiation. Because I'm sure, because I'm a radiation oncologist. What we use typically for cancer treatment is high energy X-rays. They will be in the tune of mega voltages, right? X-rays also used in diagnostic radiology, but they are kV, you know, 110 to 150 kV or, you know, different kVs. But here for radiation, which is used for cancers or other situations, we typically do it in, I would say, in mega voltages, mega voltage, high frequency X-rays. Similarly, gamma rays also high frequency rays. Now, this is about radiation therapy. If you look into how this radiation has evolved, you know, typically for laymen, let's say if the first time I have seen an iPhone 1, it was way back in 2001 or 2, not even 2, I think 3 or 4. Today we are at iPhone 17. So technology has actually shown a greater evolution.
Yes.
The same way, even radiation delivery techniques have shown fantastic revolution. That's what I call as biomedical revolution. If we look into how cancer technology has evolved, in the beginning part of 21st century, science over the last 500 years, that gap was closed. 500 years scientific gap was closed literally in the early part of the 21st century between 2000 and 2010. So that is the speed with which technology has evolved. And it's dynamic. Tomorrow, after 5 years or 10 years, still you have more advanced technologies. But as of today, this is the best technology. So what this technology evolution has meant in the field of radiation. Let's say if we have a tumor, and typically they are not circle or rectangle, they are very irregular. They can be any shape. So one of the important concepts in radiation therapy, or any clinician should know, you being a doctor also know, that you are supposed to do whatever is best for the treatment but cause no harm.
Yes.
That's the Hippocratic oath which everyone take. So when we are delivering radiation, we have to make sure we protect the adjacent areas. Let's say if cancer is sitting here,
yes,
right? We have to deliver radiation only to this area.
So
adjacent area needs to be protected. If you can't protect that area, you will have more side effects.
I know.
So therefore, our basic premise is how do we focus all the radiation dose to one particular area while mitigating the effects on the adjacent areas. So once you mitigate that, patient's compliance is good. So patients actually get benefited more because the side effects are less, the tumor is getting more dose. It's very simple concept. That's what is called as therapeutic ratio, where we tend to increase the doses to the tumor and tend to decrease the doses to the normal tissue. That is how we make sure we get rid of the tumor, keeping our side effects as low as possible.
So, Dr. Shankar sir, please tell us something about how radiation is delivered. And we now heard some new term called CyberKnife technique. So, it is very new for me. So, please tell something more about it and how it related to the cancer.
Fine. So, Pavitra, you asked a very interesting question. I'm sure everyone needs to know about that. The first thing you need to understand is how radiation is delivered. Typically, it depends on the area what we do, where we do the treatment, the stage of the disease. Now, next comes what is the intent of treatment, right? If you want to treat it with a curative intent, I want to cure this cancer, I typically use around 6 to 7 weeks of treatment.
Yes.
5 days a week, Monday to Friday. Every day the treatment will happen for 2 minutes to 5 minutes. So if the patient is given a time slot, they come at that particular treatment time. Once the treatment is over, they go
So
back.
it will be around some 1.5 months.
1.5 months treatment, yeah.
This is normal
Radiation therapy.
Yeah.
So this particular treatment is called high precision conventional radiotherapy. Conventional is like every day you eat 3 times a day, right? Here cancer gets treated 5 times in a week. The bottom line is very simple. You have to have everything at one particular time point in the treatment cycle, right?
Yes.
Now, let's say if I have an option where the treatment is delivered in a single session, right, instead of 6 weeks of treatment.
Who will not take the treatment?
Yeah, so it depends again on the areas which we treat.
But is it even possible, sir?
Very much possible. That's what is the beauty of this particular technology which we are doing. Now, when I abbreviate the treatment from 7 weeks to single session or at the most 1 week, right? You call this particular radiation modality technique as radiosurgery. Here, the radiation oncologist start thinking like surgeon. If you want to do surgery, you don't do every day little bit for 7 weeks, right?
I know. Yes, not needed.
Not needed. Here, that's the way we essentially do. We give radiation in a single shot or maybe few sessions, less than 5, get rid of the cancer. So, what is the advantage of radiosurgery? That begs the question, If you are abbreviating the treatment,
Sir,
are we not compromising? Because initially you said
that is
7
what
weeks.
I wonder.
Yeah.
Will this compromise the treatment? Because we are
Absolutely.
fevering the sessions.
During the sessions.
So, will this compromise the...
So there are two ways we look this into the treatment, Dr. Pavitra. Now, when we are speaking about outcomes, right?
Yes, outcomes.
That's very important. What you said is right. You know, if you are giving 7 weeks there and 1 week, are you not compromising? So, what really happens is there are two ways we need to look into, right? One is the biologic equivalent dose, right? Let's say if I'm hitting the cell like this, the actual impact physically say 1 Newton or 2 Newtons. But over the cellular level, it will be 10 Newtons or 50 Newtons. And that is responsible for the kill. So that impact actually at the cellular level is called the biologic impact. Now, let's say if every day we are giving 1 gram of dose, right? 1 gram of dose. And we are giving it for 30 sessions, 5 days a week for 6 weeks, right? We are giving it in 30 sessions. So what is the total dose given? 30 grams. Okay, I'm giving you a layman example. Now, what we do in radiosurgery is we give 30-gram equivalent dose in a single session.
So, will this not affect the patient health?
Absolutely not.
No.
Because this is super focused.
Okay.
You have the robotics in play which control the spillage and it is concentrated shot on the head of the tumor.
So, because as a layman, if I think, see, for a 1.5 month treatment was done in a single day,
Yeah.
I would be
So
scared.
the biologic impact of this single session will be much higher than what you get over a 6 weeks treatment. So that is what I am trying to tell. At the cellular level, the dose which actually gets deposited, that will be much higher with a single session or high doses per fraction. Because 30 grams dose, which is spread over 6 weeks, is given in a single session. But the biologic impact of this 30 gram in single session or 5 sessions will be much higher than what you get with this.
So the cost will also get reduced.
Absolutely.
Yes.
Because 6 weeks of stay in a place like Chennai.
Because I have seen people come from other states and other countries.
We get patients across the geographic borders, not only in India, but across the planet. From the Middle East, from Africa.
So just now outside also I have seen patients from other countries.
Yeah, I think they have come from Maldives.
Yeah.
So we have patients who come from across the geographic borders and they come basically more for radiosurgery because that is logistically convenient for them. They come in the morning, go back home on the 3rd day. I just tell them to go to Mahabalipuram, have some fun, and then go back home. So that
cost friendly also. Then who will not take this treatment?
That is the way it looks into. You know, at the end of the day, whatever treatment we advise, there has to be some value in it with less toxicity.
I know.
That's more important.
And also we heard this CyberKnife is non-invasive totally.
Absolutely. So that is the beauty of this particular tool. You know, we do treatments and that is non-invasive in true sense. You know, we don't you might have heard about invasive is you cut open or something.
Invasive and minimal invasive.
Minimal invasive is you put some laparoscopy and ports and then execute the treatment. Non-invasive, we just throw the X-rays. You cannot see it, you cannot feel it, you cannot taste it, but still you see the effect. That is what it is about. You know, you are able to get the intended result without any nick on the skin. Therefore, because it is non-invasive, the treatment is day care. Patient is given a time slot, walks in for the treatment, and once the treatment is over, you walk out. Because it is non-invasive, right? You have advantage of offering it for patients without anesthesia. Let's say if you need a cardiac surgery or any surgery, the first job which the surgeon does is just get anesthesia clearance.
I know.
We don't need any anesthesia clearance in the first place. So even if the patient has a heart attack, right? Or if the patient is a heavy smoker, has lung diseases, which are very difficult to manage in the anesthesia, we can still do radiation. We can do radiosurgery. So the point which I'm trying to make is no need for anesthesia. Any medical comorbidities, uncontrolled diabetes, hypertension, kidney diseases, stroke,
No
still
problem.
no problem.
Nobody, it's just
Cancer
not a
is
big
there,
concern.
we can address.
Yes.
Even if it is not considered, there are certain indications which I'll tell you, we can happily go and do treatment and come.
So in all the boundaries,
So
I would
the
consider
third
this
part,
the best treatment.
Yeah, I mean, not like that. See, it's very important. We choose our battles carefully. This is a very good technology.
It's a
But-
vast improvement.
Absolutely. It is, I would rate it as, because I have been practicing since last 26 years, I've seen the evolution of radiation therapy. 26 years before, it was a distant dream. And we had crude technologies. But still, I used to practice with lot of safety checks and all this place. So I've been, my first radiosurgery case I've done in 2003 when I returned from Pittsburgh. And you know, that has really given me a good advantage because I had that fundamentals in place and how I can manipulate and maneuver the existing technologies to get that kind of results. So there was a lot of dynamic learning that has happened over these 2.5 decades where my expertise and experience has actually enriched a big way. And I would say still today, even if I do radiosurgeries, I've done thousands of radiosurgeries, and that's one of the highest volumes in our country. But yes, even after doing so many thousands, I consider myself as a student still learning.
That is why you are here.
Honestly, I learn because there are a lot of unknowns. If you ask me a simple question, lung cancer in a patient who is not smoker, not alcoholic, what is the reason? Science cannot answer it perfectly. The same way, if you have a GBM patient, I am speaking today like this, third day I get aphasia, I cannot speak, how are you? You know, I keep speaking that way. You ask me why I got this tumor, I can't answer it. So there are a lot of unknowns which nature has still not revealed itself. See, we have to understand the basic fact that nature has got 600 million years to evolve from one cell to what we are today. Here we are trying to unlock something in just 1 decade of understanding and scientific
Something like
evaluation.
iceberg.
We are just trying to treat. We are, what I would say, not holistic clinicians. And we have not come to that stage yet. We are just trying I just burn it, the surgeon just removes it, and if it spreads the chemotherapy, the medical oncologist give it. That's how we are looking at this point of time. That is where the science as of today is. But I'm sure it will get evolved, but it takes a lot of time and it doesn't happen overnight.
This
or
itself
maybe
is
in
a big
10
improvement and a big
Absolutely.
advancement.
That's what I was telling you. Science has evolved a big way.
Big.
Last, I would say, if you look into scientific evolution era, pre-21st century and 21st century and above. I think 21st century is the cutoff before and after. That is where we can understand little bit about the intricacies of nature evolution. And so it's a great fun stuff that we are trying to understand.
So, sir, when we are saying this CyberKnife is non-invasive totally, also it is said to be more accurate and
Precise.
So it helps to protect the healthy tissue
Absolutely.
surrounding the tumor, right?
Yeah. That is the most important
Is it
part.
effective in that way also, sir?
Yeah. See, at the end of the day, let me tell you one thing. This is the cancer. Now, all this is the normal area. If I want to throw a beam, I'll throw it like this.
Yes.
I'll throw it like this. I'll throw it from here. I'll throw it from below. Try to avoid the normal tissue. You can't avoid it. You have to go through it.
Go through. Yes. Anyways, we have to go through it.
We have to go through it. But when you're going
then
through,
we control the damage.
Exactly. In a way which is good for the adjacent areas. So when I want to hit it, right, one day I'm hitting it like this. Second day when I hit it, it should go at the same place.
Yes.
Right? It can't go here. If it goes there, your precision is compromised.
Yes.
right? You can't take that precision in a different way. So you have to make sure that today I'm hitting here, tomorrow also I have to hit there, third day also I have to hit there, fifth day also I have to hit there. So if we are hitting at the same place, we are dealing with a highly precise technology, sir. Now, when I say accuracy, whenever I'm hitting, it has to be at the same place, right? Same fashion it has to cover. That is, it should not be one day here, or one day here. You know, it can't be accurate. So when you say accuracy, it's about focus shot.
Focus.
Yeah, that's more important.
So CyberKnife is helping for that.
CyberKnife, because it is taken care by robotics in delivery, you have sub-millimeter accuracy and precision.
But
we can guarantee it up to less than 1 millimeter. 1
Oh.
millimeter is a dot. We are speaking about accuracy of the algorithms which we use for treatment execution in terms of sub-millimeter. If we are treating this tumor, let's say this is a tumor, and this is my lung, and
gets moved.
this tumor is moving. So when I want to radiate this particular area, I tend to include the entire range of movement, right? So what happens? It is moving, let's say 1.5 centimeter. We are including entire 1.5 centimeter. So in the process, you're delivering more doses to the adjacent lung tissue, right? Now, how do we offset this problem? Because if
Yes.
you are trying to increase the doses on the adjacent areas, you actually tend to
damage the healthy
normal
tissue. Yes.
lung. So technology has given us an advantage, because this lung, whatever tumor you are seeing, what we do is we ask the patient to take a deep breath, hold it for a few seconds. That's the time we shoot it.
Okay.
Right? This is something which is called as gated therapy. It's something like, auto doors you see in the entrance. You stand in front of auto door, what happens?
It opens.
Gate opens.
Yes.
Once you're out of that, the gate closes.
But
so same way, when we are planning to give radiation, the tumor stops, then the treatment is executed.
But still it is tough for the patients.
Exactly, because
they
patient
can't
is
hold
asking to hold
the breath for
and it
so
is
long.
done for 20 seconds. People can tolerate for 20
Yes,
seconds.
20 seconds is
But
okay.
it is not single time. He has to do at least every 2 minutes, 20 seconds for at least 20 times.
Then it is tough.
Exactly. So that is where CyberKnife gets an advantage, because the robot actually breathes with the radiation.
That is excellent.
Yeah. So if the robot is also breathing along with the tumor, you are getting the best form of accuracy.
Yes.
That is the beauty of CyberKnife system. So for extracranial moving targets, specifically the lung, for the liver, for the pancreatic, one of the best options which we use
CyberKnife.
is CyberKnife technology.
That is amazing. So when we are talking about CyberKnife, please tell me for which sites we'll be using it, and when you are only telling like you have to be so specific about the
choosing the
battles.
Yeah.
So tell me like where we can use it.
We choose our battles carefully,
That
like
is
lung
good.
cancer, liver cancer, pancreatic. Similarly, prostate cancer, one of the best options is radiosurgery. Now the technology has actually evolved in such a way that you don't need to use a knife.
Yes.
It's ultra precise, so you can deliver good results with SBRT comparable with what you get with surgery alone. Many a times we also salvage those patients who underwent surgery, failed after the surgery is done, and we can salvage it very well with radiation also. Lastly, we also do for the cancers. Again, all these treatments, what I am telling, patients complete in 5 sessions. 1 week stay.
Who will not say no for this?
Yeah, obviously. Logistically convenient.
Yeah.
Financially less toxic.
I know.
Because you are offsetting 1.5 months stay in Chennai.
This very tough for
even if
outsiders.
we day 2,000 rupees, in 1.5 months, you'll end up spending almost 1 to 1.2 lakhs just for your stay. If you add everything else, it will be 2 lakhs of extra spending. So much of financial toxicity is decreased. So we need to think at the larger perspective. It is not just this thing. And lastly, these particular areas, what we do the treatment, if there is, let's say, head and neck cancers, those are recurrent after complete treatment, still we can salvage with radiosurgery. So essentially, time has taught me one thing, how to choose the battles carefully so that the patient gets at most benefit.
That is why they trust Apollo and they come here.
Honestly, I would say it's a teamwork.
I know.
See, at the end of the day, the best results are given by the teams who are involved
Yes.
in the process. And luckily at Apollo, we have the best teams. I'm supported by my own set of surgeons, by radiologists and colleagues, wonderful colleagues who help me in getting the best for our patients.
Thank you, sir. Thank you so much for sharing all your wonderful experiences
Most
with us. I had a great time because I get to know so many things about the CyberKnife and cancer's new advancement in techniques. So thank you, sir.
So much, Pavitra. I really appreciate the time you have given to us. I hope this knowledge percolates downstream to all the intended audience in the right spirit.
Yes, sir.
And if any patient has any query, please feel free to get connected with Apollo Therapy, and we would be more than happy to assist you. Thank you.
Sure, sir. Sure, sir. Thank you. Thank you, sir.